This patient came to see me for endodontic retreatment of tooth number 30 6 months ago. According to the patient, the root canal was done a few years back. A few days prior to him coming to see me, he says his gum tissue around the tooth became all swollen up. His sister is a nurse, so she gave him antibiotics, and he took the antibiotics and the swelling went away, pain went away, and the patient came to see me a few days after that. When I saw him, there was no swelling. I didn't notice any swelling. As you can see, there was a crown on the tooth, percussion tender, palpation slightly tender. Probings were 2 to 3 millimeters. And as you can see, radiographs show previous root canal, periapical lucency here, and a lateral lucency here, or basically furcation involvement right there. So we discussed options with the patient, and patient said, let's go ahead and try to see if we can save the tooth. He wanted to save it, so he wanted us to go ahead and redo the root canal for him. And that's what we did. We went through the crown, removed the buildup, removed all of the guttopercha, and redid the root canal for him in one appointment. So this is the date when he came to see me for a consultation, as you can see, 6 months ago. And again, you can see the condition of the tooth, periapical radiolucency here, and furcation involvement. You can see the big, large lucency right in the furcation area. This was immediately after we redid the root canal for him 6 months ago. Again, we did this in one appointment. So this is immediately after we redid the root canal. As you can see, 4 canal systems. And again, here's the date, as you can see, 6 months ago. And this was today. Patient came in for his 6 months post-op check, and take a look. All his symptoms were gone. He had no symptoms. There was no swelling, no tenderness, no erythema. That large periapical lucency healed completely. Look at the furcation. Look at that furcation. All of that furcation bone that was destroyed and eaten away by the infection all came back just within 6 months. 6 months post-op of tooth number 30. Again, remember, we redid the root canal in one appointment. 6 months post-op of tooth number 30. Infection here healed, furcation, bone came back, was regenerated, and here's the date. As you can see, it was just now, today. Let me put them next to each other, pre-op and 6 months post-op, so you can see what was achieved. And take a look. 6 months ago, before we redid the root canal, and 6 months post-op today. Periapical lucency here, furcation involvement, and this was today. Look at that. We did, again, remember, we redid the root canal in one appointment. So again, you can see one appointment versus multiple visits. The success rate is the same. Sealer extrusion doesn't have a negative effect on the outcome of the endodontic treatment. One visit endodontic retreatment or treatment has the same success rate as multiple visits. And here is another case, another proof. Again, look at all of that. All of that bone. So this was endoperio. So we fixed the endo, the perio got fixed by itself. 6 months ago, pre-op. Here's the date. Periapical lucency here. Furcation bone loss. Today. That's the date. Excellent.